Hi, this is my project for global issues. It is violence in hospitals. Just a little bit about me. My name is Mila Hovatter, and I am a first-year nursing student. I currently work as a patient care technician at Geisinger in Danville, and I decided to make this project because I have seen firsthand the effects of workplace violence in hospitals, and I think it's a very important topic that needs to be discussed. Violence in hospitals towards nurses, doctors, and other members of the healthcare community is a growing problem in many parts of our world. Workplace violence has been documented in healthcare systems globally without a clear link to wealth, type of organization, or cultural factors. Many healthcare organizations and clinicians have observed increasing rates of violence over recent years, with a recent rise in negative impacts on healthcare workers. In this presentation, I will present the effects, statistics, and prevention, and some real-life experiences on the topic. The effects on the staff. According to the National Library of Medicine, the violence in hospitals towards staff members is linked to poor worker health outcomes, staff turnover, and medical errors relating to the validity of staff licenses. The spectrum of violent incidents ranges from verbal and emotional violence to physical injury and even death for healthcare workers worldwide. More effects on the staff. Physical injury and trauma. Staff experience direct injuries from biting, kicking, punching, and weapon use. Physiological distress. Documented effects include acute stress, depression, fear, anxiety, anger, and feelings of worthlessness. Long-term effects. Increased risk of suicidal ideation and PTSD, which can lead to long-term disability. Physical symptoms, chronic fatigue, sleep disorder, and eating pattern disturbances. The effects on the patients. Workplace violence in hospitals, ranging from verbal abuse to physical assault, significantly compromises patient care by fostering a fearful culture, increasing staff burnout, and reducing attentiveness. It leads to higher staff turnover and absenteeism, which directly results in a reduced quality of care, increased medical errors, and delayed patient treatment. More effects on the patients. Compromised patient care and safety. Violence leads to lower worker morale, increased turnover, and decreased productivity, which directly negatively impacts the quality of care, causes medical errors, and possesses safety risks to other patients. Reduced staff availability. Increased absenteeism due to injuries, burnout, or physiological trauma among healthcare professionals leaves units understaffed. Diminished trust and experience. A hostile work environment caused by violence can lead to less compassionate or rushed care, affecting the patient's experience and trust in the healthcare system. Risk to other patients. Violent, disruptive, or aggressive behavior by patients or visitors, especially in emergency or psychiatric settings, poses a direct physical safety threat to other patients. The effects on the companies and the hospitals in general. Burnout and turnover. High, consistent rates of violence drive experienced staff out of the profession, worsening staffing shortages. Decreased quality of care. Fear and low morale lead to decreased productivity, lack of concentration, and ultimately poor patient care. Reduced trust in management. A sense of working in a dangerous environment often stems from inadequate security and lack of support from leadership. Absenteeism. Injuries and physiological trauma directly lead to increased days away from work. Statistics. Between 1988 and 2019, 21 doctors were killed in Italy by patients or their relatives. In 2021, 161 medics were killed in 49 conflict zones. In China, 101 incidents of serious medical violence occurred between 2003 and 2013, in which 24 doctors and nurses died. According to the World Health Organization, it is estimated that between 8% and 38% of healthcare workers suffer physical violence at a certain point in their careers. At the same time, many more are exposed or threatened with verbal aggression. More statistics. 156 healthcare workers were killed at their health workplace between 2011 and 2018, in the U.S. averaging about 20 deaths each year. Since 2017, at least 10 doctors have been violently killed in the Philippines, with doctors being subject to bounties and targeted because of perceived political affiliations. Some preventions In 2022, the Joint Commission issued new and revised consensus-based standards that implement a framework for effective hospital workplace violence prevention systems, including leadership oversight, policies and procedures, reporting systems, data collection and analysis, post-incident strategies, training, and education, extending these workplace violence prevention requirements across all of its accreditation programs. My experiences. As I have worked in a hospital since August of 2025, I have experienced a lot of workplace violence firsthand. I have seen many amazing healthcare workers come and go because a lot of these times these events are brushed off. It is a common saying that healthcare workers choose this and know what they are getting themselves into when they go into the field. That is entirely untrue, and nobody deserves to feel unsafe or unseen in their workplace. This common issue is something that needs to be addressed by hospital companies worldwide. And then my resources, I use the National Library of Medicine, American Hospital Association, and the Occupational Safety and Healthcare Administration.